I'm Kaylee.
I'm Allison.
And I'm Kara, and we're Davenport University nursing students. Today we'll be talking to you about OCD and eating disorders.
The first topic we're talking about is OCD. OCD is an obsessive compulsive disorder, known also as an anxiety disorder, in which people have unwanted and repeated thoughts, feelings, images, and sensations, and engage in behaviors or mental acts in response to these thoughts or obsessions. We also have provided in our PowerPoints a video of what it's like to actually live with OCD, so you guys can grasp a better understanding of what it's like.
The next topic we'll be discussing are eating disorders. Eating disorders are irregular eating habits and having severe concern or distress about their body weight or even shape. There are many different eating disorders, but the three most common ones are anorexia nervosa, bulimia nervosa, and binge eating disorder. We will also be providing you a video on our PowerPoint so you can get a better understanding of living with eating disorders.
Now we're going to compare how OCD and eating disorders are related. Eating disorders are often directly connected with anxiety disorders such as OCD. Compulsive behaviors often observed with eating disorders include obsessive thoughts about food and calories, food rituals such as cutting food symmetrically, hoarding of food items, frequently weighing oneself, tracking intake of carbs, sugars, fats, etc., and constantly body checking or examining appearance in mirrors.
The three main types of eating disorders we'll be talking about is anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa is a fear of gaining weight and having an unrealistic perception of their body image. They usually try to limit their intake of food because they believe they are overweight when they are not. Bulimia nervosa is a repeated binge eating followed by forced vomiting, excessive exercise, or extreme use of diuretics or laxatives. Binge eating disorder is losing control over eating and binge eating large quantities of food.
I'll be talking to you about some eating disorders and their mortality rate facts. Eating disorders have the highest mortality rate than any mental illness. 1 in 5 anorexia deaths is by suicide. Suicide is the most common cause of death among individuals with eating disorders. There is an increased risk of suicide attempts in anorexics who are older, low in weight, and struggle with substance abuse. There is also an increased risk of suicide attempts in bulimics who have comorbid psychiatric diagnoses and have a history of physical or sexual abuse.
Next, we'll be talking about the treatment for OCD. One type of treatment for OCD is medications such as your SRIs and your SSRIs. Next is your behavioral therapy, such as cognitive behavior therapy. The next one is self-help or support groups, which have been shown to be truly beneficial for patients with OCD, stress management, and family support. Next, we'll be talking about the treatments for eating disorders. One is nutritional education, such as working towards a healthy weight, meal planning, and establishing regular eating patterns. Also, cognitive behavioral therapy is very beneficial for these patients. Family-based therapy, cognitive group behavioral therapy, and there are no specific medications, but they can take antidepressants to reduce any depression or anxiety.
Family members can also be affected by those who have eating disorders or OCD. If you're a family member and want to help a loved one, we have some do's and don'ts. First of all, you should talk openly and be honest with them. Express your love and support and try to make yourself available. Take the time to listen to what they have to say. Also, know your limits and respect them, but most importantly, just be patient. Some don'ts would be don't try to be a therapist. Don't blame, shame, or guilt. Don't ignore them. Don't threaten them with consequences, and don't use you statements. Also, don't try to force someone to stop eating, or exercise.
Next, we'll be discussing the medical complications of eating disorders, starting off with anorexia. First and foremost, heart failure is a big one and it can be fatal. Muscle loss and weakness, severe constipation, amenorrhea or a loss of a period for women, and infertility are big complications for anorexia. For bulimia, heart failure, inflammation or possible rupture of the esophagus, peptic ulcers, pancreatitis, and infertility are big medical complications. And lastly, binge eating, type 2 diabetes, kidney disease, hypertension, high cholesterol, heart disease, and arthritis are complications of this eating disorder.
Next, we're going to take a look at the myths and facts about eating disorders. One myth is that you can tell if someone has an eating disorder just by simply looking at them, when in actuality, individuals with eating disorders come in all shapes and sizes. Many times, the media and other public discussions about eating disorders focus solely on individuals with anorexia, who are severely emaciated. In reality, many of these individuals with anorexia may not even appear so drastically underweight. Furthermore, many individuals that are suffering from bulimia and eating disorder can be underweight, have a normal weight, overweight, or obese, and can fluctuate in weight often. Even athletes who appear to be incredibly fit and may be struggling with an eating disorder. Yeah. The bottom line is that you can't define someone's health by how much they weigh, and you cannot determine whether they have an eating disorder just by looking at them.
A second myth is that eating disorders are a lifestyle choice, that someone can choose to stop having an eating disorder, when in fact, eating disorders are a serious illness with mental and physical consequences that often involve a great deal of suffering. Someone can make the choice to pursue recovery, but the act of recovery itself is a lot of hard work and involves more than simply deciding not to act on symptoms. In most cases, the eating disorder has become a person's primary way of coping with intense emotions and difficult life events. In order to heal from the eating disorder, a person needs appropriate treatment and support regarding medical monitoring, nutritional rehabilitation, as well as learning and practicing healthier ways to manage stress.
A third myth is that purging is an effective way to lose weight. Fact is, purging does not result in ridding the body of ingested food. At least half of what is consumed during a binge typically remains in the body even after self-induced vomiting. It's important to know that laxatives do not prevent the body from absorbing calories, either because they impact the large intestine and most calories are absorbed in the small intestine. Laxatives may provide an illusion of weight loss because they stimulate a temporary loss of fluids from the body, which can lead to dehydration. Purging does not cause weight loss, nor does it prevent weight gain. In fact, over time, the binge-purge cycle can actually contribute to increased or accelerated weight gain as it affects the body's metabolic rate.
Another common myth is that men don't get eating disorders, when in actuality at least 1 out of every 10 people with an eating disorder are male. In fact, with categories such as binge eating disorder, men represent as many as 40% of those affected. In a recent report released by the American Academy of Pediatrics, boys and men were cited as one of the groups seeing the fastest rise in eating disorder over the past 10 years, along with 8 to 12-year-olds and ethnic minorities. It is equally important to screen for eating disorders among females and males.
This concludes our video on OCD and eating disorders.
We hope that you guys learned a lot about the differences and similarities between eating disorders and OCD.
You can find a list of our references at the end of our PowerPoint. Thank you.